Well, hello, dental assistant rock stars. And with everything going on today, I know there's been some questions and concerns about the mask on our face that we are going to be wearing. And today I have Linda Harvey of the Institute of Dental Compliance. And I thank you for taking time out to educate all these dental assistants. They have all these questions about masks. What are the right ways, wrong ways? How many? What do we need? All these questions that we need to get answered. And I thank you for taking your time with us today.
I'm so happy to be with you, Julie. Information is changing so quickly. I'm looking forward to helping your dental assistants and all of our teams with everything.
It is. So you, before we got on, you said there were some changes with the update of the CDC. So as of yesterday, I think, right? Or the 27th?
Yes. So yesterday, OSHA published something new specifically for dentistry related to COVID and PPE. And then earlier this week, or maybe it was last week now, the 24th around there.
Who knows?
Dates are getting confusing. The CDC I'm sure it was last week, published some updates for us as well. So what I'd like to talk about this morning is this new information from OSHA, because it's specifically on a page that is for dentistry workers and employers.
Okay.
And it recaps a few things about how we were being called to close our offices, since back in March.
Right.
And we perform the emergency procedures like we've all been doing. And now that we're opening up this great page, and I'll send it to you so we can put it up on your
I'll link
page.
it up. Mm-hmm.
Yeah, it talks about dentistry works with tasks associated with different exposure risk, and we know that. So this OSHA page outlines the low, medium, high, and very high risk. And the very high risk are performing aerosol generating procedures with known or suspected COVID-19 patients. So at this point, we are working very diligently to triage those individuals out so we don't see them.
Right.
And if someone with COVID-19 had a true dental emergency, they would have to be treated at a higher level facility, go to the hospital and be treated there. And perhaps maybe at this point with the use of teledentistry, that our doctors could make a diagnosis and do some triage or, palliative care remotely until they can get over the symptoms. But then we come to the high risk. So we wouldn't see the very high risk, but the high risk are entering a known or suspected COVID patient's positive room in the hospital, providing emergency dental care not involving aerosols to a high-risk patient, and performing aerosol generating procedures on well patients. That's the one that's going to pertain to us. Performing aerosol generating procedures on well patients. Right. And that puts us in the high category with OSHA. So with that being said, now they go on, and I haven't truly digested the whole information here.
Right.
They go through just like OSHA does, CDC, and talks about engineering controls or administrative controls, safe work practices. But when it gets down to PPE, Julie, they delineate it between well patients and patients with suspected or confirmed COVID.
Okay.
Now, how do we know, with standard precautions, we treat all patients as if they're contagious. So where do we draw that line? Do we automatically dump everybody into suspected patients? Well, hopefully we're able to, triage, like we said, and get folks out that are exhibiting signs and symptoms or have been traveling. Like in your case in New York, if you were to have family move up or someone come see you and they've been in and around New York City, or their loved one has worked in a hospital in New York City, then you would say, okay, that person's probably a little more suspect just because of what they've been doing in the past 2 weeks. So if we put patients in that suspected category because we don't know for sure, then it definitely talks about having the NIOSH certified disposable N95 filtering face piece respirator or better. So they say disposable. So does that tell us that it's one per patient when we can't even get our hands on enough? Probably so. Mm-hmm. Then with the well patients, any dental procedures that may or are known to generate aerosols, also same thing, the gloves, the gown, the eye protection, which includes face shield or goggles. And then again, the NIOSH certified disposable N95 filtering face piece, respirator or higher. So no matter what you're doing, unless it's a well patient who has no aerosol generating procedures, OSHA is saying we should be wearing the 95 respirator mask.
Okay. So even before, they were saying a level 3 with a face shield and goggles underneath, which I would probably wear if they fit properly. They're not saying if we're generating aerosols now, it's just the N95.
Yes, and so let's overlay CDC and OSHA then, because CDC did tell us that to wear the highest PPE available, which included the 95, and if you couldn't buy one,
Right.
then use the level 3. So that was the alternative. But now OSHA has taken a stronger stance and says, for any well patients, any procedure that generates aerosol should be the respirator mask. Well,
Okay.
that being said, we know there's a shortage. So let's talk a little bit about that for just a minute.
Yes. Mm-hmm.
This is where we're learning all about these new things with respirator masks. We'll put some pictures up and everything on the website or Facebook page and really have some good resources. So the KN95 masks are respirator masks that are made abroad in China and Asia and different places. So right now in our country, we have permission from the Food and Drug Administration through what's called the emergency use authorization to use these, other masks that are not manufactured here and do not meet our NIOSH certifications.
Okay.
Or NIOSH approval, rather. So NIOSH is the National Institute of Occupational Health and Safety, and that organization is tucked up under the CDC.
Okay.
So, and that's different than OSHA, and it's different than, this is all the different organizations. So NIOSH is the group that puts that stamp of approval on on N95 mask. However, if we go a step further, there's not just a surgical mask that we've been used to wearing, and I'll hold one up and, as if we were going to be seeing one, just the regular old level 1, 2, and 3, right?
Right.
It's not, that's a surgical mask, and that's got to be FDA cleared. So we buy from reputable sources that have that.
Absolutely. Yeah.
But then when you look at how these two overlap, NIOSH and the Food and Drug Administration, there's a part of this, if you took the overlapping circles, the part in the middle is where you would find a N95 surgical respirator mask. Surgical meaning that it's got the fluid resistance, that would protect them, like a level 3 has more fluid resistance than a level 2.
Okay.
Only now, this N95 mask that's a surgical mask, or called surgical respirator mask, has both of those capabilities built into that 95 mask. And that's what we have a shortage of. In an ideal world, we would be able to purchase whichever size mask we need.
Right.
For example, we need the regular or we need a small. Mm-hmm. Most of us have just been clamoring to find any kind of mask. We're not even in tune to the fact that whatever you buy may not fit all the team members.
Right. Right.
So,
and talk about, because this is a lot of issues, we just can't, as assistants, we just can't be thrown a mask by our boss and said, here, put this one on. This is what I've purchased. What is the process that we should go to make sure that, one, their investment that they're investing in this PP is going to be used correctly to protect what it's supposed to do? So what is the process that we need to go through right now? And are there any loopholes because certain things might be on back order?
Yes. So when you think about respirator protection, that puts you squarely having to follow another OSHA standard. And right. That's OSHA's respiratory protection, standard. And that standard is what we're going to talk about now. That standard requires that you have a respiratory protection plan or policy in your office. When do you need it? Why do you need it? And going through, what's available in your office. 2, the team members that are going to be expected to wear these masks, whether it's voluntary or not, most folks are going to want to wear it, right?
Right.
Or mandatory. And so that they have to have a medical evaluation, Julie, to be sure it's medically safe for them to wear the mask. I don't know if you saw this story, but there was a nurse, and I forget which hospital the nurse had worked in, but the nurse had worked all day wearing an N95 respirator mask, got in their car, and was driving home with the mask on still, and got into a car accident.
Right.
And that's because your breathing, your heart and your lungs are taxed. Even healthy people that work out are going to have an issue with it because we're not used to wearing it all day long. So we're going to have to, like you said, go slower with the schedules and use these and make sure they fit properly. So after those 2 things, the third thing is to have some training. What all these terms mean? What's a fit test? What's a medical evaluation? What is a user seal check? And then just understand how to don and doff these masks. It's very different. Because the last piece is then you have to go to a professional who's trained, like you and I have taken the training, or experienced because they do this for a living, like an occupational health specialist, nurse or physician, and actually have the mask fitted to you to be sure it's the proper mask. We can put it on, we can put the straps over and think, oh, it feels like it's okay, but we don't know for sure. So there's several things that have to happen, and they put it on, they do some different checks, and then they put a hood over your head. So don't panic. I know everybody that's listening is thinking, oh no, I don't want to, it's going to be all dark.
Hood.
No, it's got a big opening in the front so you can see your person that's doing it.
Right.
And they spray either a bitter solution or a sweet solution to be sure whether or not you can smell it or taste it. And if you don't pass that, that means that the fit of the mask is not for you.
Right. Absolutely.
So those things have to happen. The medical evaluation can be online. I think I told you we're going to be offering it online.
Yeah, I can't wait. So I can, yeah.
About that.
And it's quite lengthy because I took it through that other company and I was surprised. I felt like I was getting a life insurance policy about all the questions they were asking me. And it's just, I mean, there's a lot of questions that it deals with your respiratory and your lungs. And are you a smoker? How long have you smoked for? And, you know, do you get winded coming upstairs? And all these things that you don't think about with your breathing that I was like, do I? Don't I? Wow, I can't just put that on my face. And I haven't even worn one yet. And I was still like, I was starting to get anxious just thinking about wearing one because I was all these questions that were going on. And then at the end, they're like, oh, you passed. You can, you know, get the fit test now. And I'm like, oh, great. Okay, phew. But what happens if you have team members that might have respiratory issues or asthma or any of these things that, you know, are happening, you know?
Let's go into that question a little bit more. So when our dental assistants take that questionnaire, as you mentioned, it's very extensive. The first part of it, didn't you find was like any medical history in a dental or medical office? But then it really went in depth, as you mentioned, Julie, to your respiratory health, your lung health, smoking, and also asking a lot of detailed questions about the environment and circumstances that you're going to be wearing this respirator mask.
Right.
You're going to be in a humid environment. Well, in Florida, it's humid, but we're working inside, so that's a controlled environment.
Right.
Will you be wearing this with other PPE? Yes, and you had to tell them what PPE, like the face shield and a jacket. You know, I put lightweight, but I wrote lightweight, you know, cover jacket. I forget how I phrased it because it was pretty lightweight considering winter coats in New York, right?
Right, absolutely.
And then they asked, do you work in a confined space? So some of you might be just kind of chuckling right now because you feel like your operatories are kind of small, but you have a full doorway and maybe two-way going in and out. So it's not really a confined space according to what I would expect OSHA to think of, you know, with other industries, for example. So those may be some questions that could kick you out if you don't answer them properly, but just as your other questions. So if you pass, then you get your certificate right away, like Julie and I did. And then if you don't, then within 48 hours, you're speaking to one of their licensed medical professionals that will then counsel you to let you know what the next steps are. Right now, I don't know what the next steps are because I don't know anybody that's failed yet. We haven't launched it, but we've all passed.
Well, and hopefully our team is honest. I mean, I don't know my full team members' health history. I mean, things that would affect their job, but maybe there's things that they don't want us to know. So hopefully maybe you have a closet smoker. I mean, or a closet vapor. I mean, I don't know. So, I mean, these are things we have to be honest when we answer that thing, because I don't need people passing out chairside or walk by their room and they're passed out or they feel like they're going to get lightheaded because they're wearing something that really, it might affect their health and not do the right thing for them.
Oh yeah, it's all about doing the right thing for them. And that's totally number one. And then when you think about our behavior, that's going to cascade to the rest of the team. So if you fall out, you get sick or you faint and you got to take a few days off, now you're kind of out of the mix and you're not going to get paid probably for sick leave at this point. Who knows? But you just have to think about the cascade of events that happen from not meeting the requirements and being honest on those and doing what you're supposed to do. Yeah. And you got great dental assistants on your page and you're following. So they are.
Yeah. They're trying, and we were just talking about, doing the right thing, and it's hard. And so one of the issues they brought up was, are they reusable? And what do you do if they buy a machine or say, oh, we're going to do this way to reuse them? What, as one that works in infection control, what would you talk about with that?
Okay, where I'm taking everybody now is the collaborative conversation. So that way we don't have the dental assistants thinking one thing, the doctors thinking one, the owner doctors, the employee dentist, and then the hygienist all in their own camps. So it's all about, and that's why we're here today, because we're all collaborative.
Mm-hmm. Right.
So collaborative conversations. So if a doctor comes in and found this great new device that they're going to purchase, and now they're going to sterilize the mask, you can't sterilize it. You may only be sanitizing it. And you probably have seen and heard the news stories of how they've been doing that. Just so you use New York City as an example again, or even one of our hospitals here locally, Julie. I was texting with the head of compliance a few weeks ago, a colleague of mine, and they're using a medical grade ultraviolet light that they use to sanitize other things in their hospital setting, to sanitize those masks. And that's all interim for this time. I'm suspect that they won't be doing that once the crisis dies down and they don't need the mask as much as everybody needs them now.
Right.
So I would say at this point, it may not be wise for the doctor to invest, multiple thousands of dollars at this point, giving everybody's financial situation. Rather, it's better to just invest in the mask now. And what we can look at is go back to the CDC guidelines and look at the OSHA now guidelines or the OSHA standards that talk about, using a surgical mask when there's no aerosol generating procedures. So the doctors can certainly wear, a level 2 mask even when they're checking hygienist. Because the difference between a level 2 and a level 3 is not the filtration, because they both have the same filtration. It's the fluid resistance. And for hygiene checks, we don't need level 3. So level 2 would be one. Whereas in the past, we might say, oh, level 1 would be good. But now we're trying to be more cautious. So to talk to the dental assisting team is when there's anything happening that you don't need an N95, then switch out masks for something else, like a post-op check or a new patient exam or something along those lines.
Okay.
Otherwise, they're probably going to be disposable.
Yeah. So in the event the dental assistant gets a mask, or the team member gets a mask and they're not fitted properly, let us know, like, what do you think could happen from it not fitting properly? What are some repercussions that we should be aware of from them not fitting properly? Because the purpose is not to get any aerosols and protect you, but what could happen besides them maybe getting, if a patient doesn't realize they have COVID and no signs or symptoms, they could get that, but also, what could happen if it doesn't fit properly?
Well, what could happen if it doesn't fit properly? Let's go over, like, when it does fit properly, it's tight over your nose and your cheek and your chin. So when you're breathing exactly through the mask. So if you're not able to get that seal, which is what we're looking for, the seal, because every time you put on a mask, you're supposed to do your own user seal check, meaning you're just double checking to be sure that you've got it pressed down and it's all tight. So if you can't get that seal check and you fail the fit testing, then hopefully the doctor can find some different masks for you, maybe through co-oping. We know a lot of doctors that maybe one doctor's buying 1,000 and they're splitting it with other offices. So quickly mobilize with our online, connections, within the community and other dentists, and see if they can buy a different brand or smaller size or different size that could fit you.
Right.
But if not, then you probably would, I don't know, Julie, if you would even be, would you be any better than if you, because of the gaps in a level 3 mask?
Right.
Maybe a little better, but scientifically, I don't know how much better you would be. It's probably better to wear N95 anyway, just in case, with the face shield over it, than to revert to level 3, because there's a lot more gaps in it.
Now, with the fit test being on back order, which we both know are back order or lack of, or what are the safest steps, even though somebody cannot be fit tested for them right now, what are the safest steps for a team member or a dental assistant or team, shall I say, to have the medical clearance, the written protocol on file if OSHA was to come in, right? Okay.
So what we're trying to do right now is develop that good faith effort. So if OSHA was to come in, then you would say, okay, well, at least we have an interim plan, because this is what we know right now, and it could change in a month or and that will change, perhaps. I'm guessing perhaps once more research is done on COVID-19 and vaccinations become available and other things that could change our landscape a little bit. That's like, kind of shifting the dominoes around.
Right.
So having a good faith effort would be, like you said, having the respirator protection policy, even if it's an interim one, having the medical evaluations to show that you've been cleared to wear that, and then do some type of training. Maybe you can find someone in your community or some online videos. 3M has resources where you can just watch videos, and I would stick to the ones like that are regulated like that come from industry known experts, the giants. 3M is very good. And I've been talking to their industrial hygienists. I've been reading a lot of their publications, but that way you can at least figure out, okay, how do I don it? How do I doff it properly? So when it's coming off and it's contaminated, how do I dispose of it? How do I handle it? And for the doctors, because if they're going to stop in the middle of a procedure like they've always done to go do a hygiene, this is a big change for them. So can I share some with the dental assisting team? So one thought is, and I'm going to use an analogy of a surgery center, because I have some experience with those clients. So we all can think of, like we see on TV, the surgeon walks in, they've washed his and her arms up to the elbows, and they walk in with their arms up. and then the surgical assistant helps them gown up.
Right.
Well, I think our doctors can get on their own PPE just fine. But when it comes time to take it off and go check the hygiene patient, here's where they may need your help. Because if they're going to come back to that same patient, they could use the same gown.
Right.
So if it's a disposable gown that ties in the back, then perhaps dental assistants, you could, deglove, untie their jacket, maybe roll it over the shoulder a little bit, so then the doctor can finish taking it off, turn it wrong side out and hang it up, so then it can come back and put it back on. So I'm just thinking like a little assistance like that. And there may be other things that people will think of. And once they get back to work, I want to definitely hear some tips on your webpage, on your Facebook page, Julie, because I'm excited to see how
I mean, that's what we were talking about today, was just slowing down. And as one that works in front, it comes from the front. As front office, we really have to speak up and say, we can't just shove patients in there and pack the schedule. Why, we understand that we haven't been at work. I mean, and now New York has closed schools until the end of the year, till whenever, next year, September. So I think we're going to go back May 15th? And I have a really hard time thinking that. So it's really now is the time, if our New York, where I'm at, is teams to get together and practice putting these things into place and just slowing it down a little bit, because I'd rather be slow than, jump right ahead. So, it's good. And we'll get all these resources together for you, but it's just not a one size fits all mask. It's just not. Watch where you buy, and there's a lot of fakes and phonies out there. And stuff, and you just really have to be more cautious of what you're putting on your face and what you're using to make sure that it works for you.
And I think one of my last tips would be, Julie, just go back to that collaborative conversation with everybody on the team. And I think that's where I would leave them with all this great information. So
yeah, well, thank you so much, Linda, for being on today and give us all your expertise in face masking, because there's so many questions and it could make your head spin sometimes. And I just want to make sure everybody has it. So I appreciate you being on, and we'll see you soon.
Thank you. My pleasure. Thank you, everyone.